Thank you so much to everyone for being here today, and welcome to our monthly Bridge Michigan lunch break. Today we're discussing COVID-19 in Michigan, and this one's exclusively focused on your questions. So after 9 months of living through this pandemic, things have changed a lot, and especially since we're sort of in the midst of a surge, we wanted to help you understand where things currently stand with COVID-19 in Michigan as best we can. We're not the experts on this topic necessarily, but we know a lot and have learned a lot over the course of reporting on it. And we wanted to give you a chance to ask. If we don't know the answer to a question, we'll tell you that we don't know, but we're gonna just try and fill you in on the latest of what we've been reporting on and help answer your questions about jobs and the economy, about everyday life, about health issues, obviously, the data, everything that you might ever have wanted to know about COVID-19 and where we stand in Michigan. My name is Amber DeLind. I am the membership director at Bridge Michigan, which if this is your first lunch break, or maybe you've heard about this lunch break through a friend or a family member, Bridge is an online news publication. We write in-depth policy and data-focused journalism about important things happening in Michigan, things that impact daily life here in our state. We host monthly discussions that we call Bridge Lunch Breaks. Previous discussions have discussed topics like racial justice, high water levels in the Great Lakes, questions related to November's election, K-12 education in the time of coronavirus, and more. Our next one will be held after the new year, so stay tuned, and Bridge will make an announcement for when that will be and what the topic will be. Just a little rundown of what today's discussion schedule will look like. We'll begin with an introduction from our three special guests, our three journalists that are on the call today, about their experience reporting on the virus and the latest in what they've learned. Then we'll turn to your questions that you submitted when you registered. We received more than 50 questions pre-submitted to the event, which is really amazing that there are that many questions, and we're really excited that you were willing to ask us those questions. That being said, we're going to try to get to as many as we can, but we may not be able to get to all of them today. We'll do our very best. If time allows, we'll then answer questions that you submit during the discussion today via the chat window. So that being said, if you have questions that you would like us to enter that you didn't pre-submit, you can go ahead and type them into the chat window at any time. If you're calling in today, you can email those questions to me at membership@bridgemi.com. We will be recording this discussion, and we'll be posting that recording in Bridge, Michigan tomorrow. So if you know someone who wanted to watch and didn't get a chance to tune in today, you can send them that link. With all of that being said, I'd now like to introduce you to our special guests. We are joined today by three Bridge, Michigan journalists. Robin Erb is Bridge's health reporter, Paula Gardner is Bridge's business editor, and Mike Wilkinson is Bridge's data reporter. I'll now turn it over to each of them to give an overview on sort of their reflections on reporting on COVID-19 and what they most want you to know about the virus right now in Michigan.
Who do you want to go first?
You go, Mike.
I'll go first. I am the data guy, so if you come to Bridge on a daily basis, which I hope you do, and you see our charts and our little gizmos, that's what I do. I try to make sense of the data that the state gives us on a daily basis, on diagnostic testings, on hospitalizations, on where the cases are, and then I try to make, like I said, make sense of it. Try to figure out trends and show you, like in each county, how many cases that day, what's the 7-day average. A lot of the counties themselves have their own pages that do similar things, but what we do is kind of give you a one-stop shop. We tell you where the cases are, where the deaths are, and unfortunately there have been quite a few lately, and try to just give a little bit more perspective on it. I think one of my takeaways from the most recent wave is that it is substantial. It is, we are in a spot now where I don't know where we're going to go. The case numbers are trending a little bit down, and maybe that has something to do with the pause that started back on mid-December. So that is a good news. We're still waiting to see if gatherings that did take place at Thanksgiving, and I'm not sure how many there were, we're waiting to see if those will generate another wave or surge. The hospitals, which had seen a huge increase in patients across the state from basically late October through about a week and a half ago, those numbers have stabilized, which is great, where there is now capacity in some hospitals. but that doesn't mean that there aren't some that are already at 100%. So we're at a real kind of inflection point here. And I think that's one of the reasons why the governor is, put the extra 12 days on, because it seems one way or the other could push those numbers back into really high levels. So there are good signs in the state right now. The positive rate has fallen a little bit in the last 4 or 5 days, and the hospital capacity is there. But we're at a real tricky time going into the holidays. And if you look, watch us. I mean, that's the kind of perspective I'm trying to bring every day with our dashboard and our tracker. Thank you, and thank you all for participating. And this is great to see so many people interested.
Fantastic. I'll go next because it's a great contrast. While Mike does a lot of the data diving, I've been really fascinated this year by the people that are building the data and that are building the knowledge and are building the science behind this new virus. I've been covering healthcare. I was thinking the other day, I've been covering healthcare since H1N1 in 2009. And usually I'm writing about policy and real people, but it's, the background is kind of science or data that's already settled or science that's already settled. But this year, it goes without saying, you cannot take away from this incredible grief and heartache and misery that's affecting so many of us. But from a purely science or health standpoint, it's been fascinating. Even as we're kind of watching history on school, we're also watching this science build. And just for me, it's been fascinating this year. I'm learning about viruses and spike proteins and vaccine development and the precarious state of healthcare. But what's been fascinating is watching the real people behind it. I remember very early in the pandemic talking to, somebody, when we were still trying to understand what data was most relevant and how to get the data and how to make the data, accessible to the public. I just remember this person who'd been living this for 24 hours, 7 days a week for several weeks. She just stopped and there was this long pause and she apologized. She says, "I'm just so tired." So for me, it's been really interesting this year as a health reporter, just watching the very human buildup of what we're dealing with and how to battle it. So it's been a learning year for everybody, but it's really been fascinating watching this as a health reporter this year too.
Well, I started at Bridge in April when things were very, very urgent, and I'm creating a new beat here. We had never had business coverage per se from one dedicated reporter. When I look back at that time and consider what I thought I'd be doing at this time or what I thought I'd be seeing, I really thought that we'd be in the middle of a complete economic meltdown. And what's been surprising to me is there are people who are suffering. The unemployment rate remains high. And there are industries that are struggling very, very much, but we do not have that complete economic meltdown. However, over the next year or two, we might, depending on who you talk to and what happens at the federal level and how the state responds, and also just how the average person responds. I've been trying to tell a lot of different stories. Some things that surprised me is how I ended up turning into an unemployment compensation reporter. And digging into jobless benefits, which was hugely interesting to people. I thought at Bridge I'd be telling some Michigan success stories, but getting into that often feels just kind of trite and wrong considering the scope of what we're doing. Trying to tell a lot of industry stories. Restaurants have consumed me for the last 2 months. I just don't think we understand what's going to happen and what it means to have an entire industry just kind of on the precipice. But on the other hand, there are really good signs for the economy, and I try to get into that and understand that. And just there's so many stories I haven't told yet. I feel like there are a million that I could jump on tomorrow, and it would still be relevant to today. So.
Fantastic. Thank you to all three of you for just that introduction. What I thought I would do now is turn to some of those pre-submitted reader questions, of which I mentioned at the beginning, there are many. What I'm going to try to do is sort of rotate these by topic, but I'll try and direct them to either Robin or Mike or Paula, depending on the topic. But if it makes sense for any of you to answer, please feel free to jump in. And for those of you who are listening, please feel free to add any questions that you might have to that group chat window. So our very first question, I think, it makes sense to focus on something that seems promising, which is the vaccine. And so this one is for Robin. We're getting a lot of questions about the vaccine, understandably, right now, because it does show promise, but there's also a lot of sort of confusion and around the topic. So Robin, just generally, what do we know about the plans for distributing and administering the vaccine in Michigan?
Sure, it's a great question. You know, generally we know things from a very bird's eye view. We know kind of top level organization, but the granular stuff is still being worked out. So the Advisory Committee on Immunization Practices, ACIP, is part of CDC. The Advisory Committee earlier this month made the decision, and it's a guideline only. You probably know that healthcare workers and folks in long-term care would be first in line for the vaccine. Now, even within that top stratification, and remember the vaccine is going to be limited at the beginning, but even within that stratification, you know, there are questions about, okay, which healthcare workers, and on which shifts, and in long-term care, and just to clarify, workers in long-term care are considered healthcare workers in this particular definition, but you know, long-term care, who in long-term care? Is that skilled nursing facility, homes for the aged, assisted living? So those granular pieces, even in that top stratification, is unclear, and a lot of that decision is going to be left up to the state and the local, ultimately the local health departments. Now there is a 64-page plan. It's fun reading. There's a 64-page state plan that really goes through how the state will start distributing the vaccines, which are the partners they'll work with, whether they're homeless shelters, hospitals, public health departments. And it does list priority groups. So after the healthcare workers, and I won't go too far into it, but after healthcare workers in long-term care, I just pulled it up, we're talking about, you know, the other essential workers. Okay, who are those other essential workers? You know, the elderly. Well, are those folks that are going to, how do you reach long-term, or like the homebound folks? Racial and ethnic minority groups, tribal communities, those folks in prisons and correctional facilities, the homeless, those in rural communities. Well, those are big buckets. So trying to figure out exactly how those things are going to be handed out, those vaccines will be handed out, that's, a lot of it's unclear, and a lot of it will depend on when we get the vaccine and in what quantities. So this document, the 64-page document, is written as draft because it's always going to be moving depending on the realities of that week.
Okay, that makes sense. Thank you, Robin.
And if anyone wants to see that 64-page document, let me know. I'll send you the link. If you're having trouble sleeping at night.
If you do, send it. I'll drop my email in the chat, and you can send me an email, and I'll get it from Robin. I can distribute it to anyone who might want to take a look. The next question is really a data one for Mike, and this is one that I see. I answer a lot of reader questions for Bridge. It's one that I think people are trying to understand the data on kind of a local level. Mike, do you know, is there data for cases or deaths by city?
Within each county, you can sometimes find it. So I was just looking at Bay County yesterday, and they will do the different townships and Bay City and others. Kent County does it by zip code, Ottawa County does it by zip code, but the state doesn't release it that way. And it'd be too difficult for us to get the data from 83 counties and try to express it that way. But if you go to your local, and maybe I should, that's a good idea. Maybe I might create a link to all the county home pages, because it seems that there is some appetite for it. But you know, even Detroit used to tell you within the city where the highest rates were. You know, Macomb County does it as well. So it is out there, but the state does not release it currently in that form.
Thank you, Mike. I appreciate that. All right, let's turn to our next question here. So this one is for Paula. Paula, this is a big picture question. You can break off whatever pieces of it you might like. This person wondered essentially, what have the shutdown orders, the various ones throughout the course of the pandemic, or perhaps just the current one, What have been the impacts on the various sectors of the economy? Do we have any evidence of what works and what doesn't as far as balancing the needs of employers and employees as well as public health?
Yeah, that is a complicated question. I guess to look at clues, we could look at outbreak data to understand how different types of industries are affected. The things that I hear are over the course of time, most businesses have felt either confused or somewhat victimized, even as they understand that we've been dealing with a pandemic. And that kind of depends on, where they are in reopening. So stores right now are operating at 30% capacity, but they are not closed, and it's the holiday season and they're able to still sell. So they feel fortunate to be able to do that. All the retailers in Michigan, even if they're struggling, even if they're having to do more online, they're still able to open if they choose. Restaurants, I'd mentioned those earlier. That's a disaster. And especially when you consider what restaurants mean to different communities, downtowns, as catalysts for other development. Manufacturing has a number of outbreaks, but the manufacturers themselves will tell you that they're containing well. I think they feel control over who comes into their facility and what happens once they're inside. So the number of outbreaks might kind of raise questions about that. There's a little bit of tension there about whether that's truly accurate. But there are 12,000 of them in Michigan. So when we see outbreak numbers under 100, the scale of it is not enormous. I think one thing as a consumer, I worry about being exposed when I shop or when I'm just out in public. And one thing that outbreak data does seem to show us is that customers are not as affected as employees. So people who go to work actually need to worry about it more, is my personal conclusion. I'm not a doctor, but it does seem that exposure affects employees more. So things like working from home actually is a tool that the state has put in place, and many employers. So if you're able to work from home, that's a benefit.
Absolutely. Thank you for that. I'm just looking through our many questions and trying to make sure that we're answering them sort of in a order that makes sense. Robin, this next one is also sort of a vaccine related question, and I don't know whether the science is settled on this, but you would know more than I. Do we know if people who have had COVID and therefore presumably have antibodies would need a vaccine?
That's a great question, and we don't know. The current science is, yeah, absolutely. And the reason is a couple of things from what I've been told. One, we don't really know if the vaccine helps you not get sick, reduce your symptoms, or the vaccine actually helps you, not replicate the virus. That's a very layperson way of saying it. And I'll be honest with you, there are people who know much more about this than I do. But there are a couple of things to keep in mind. One, even if you've had the antibodies, we know there are rare cases of reinfection. We know that. In fact, I actually talked to a friend just last night, a personal friend, who's been reinfected in New York. So we know there are those rare cases. And again, we don't know if the vaccine, with the vaccine, you just simply don't get sick. So you still may be shedding that virus. So the current understanding is absolutely those folks will get a vaccine. But if you read some in depth in some of the materials, those folks who have been most recently infected are thought to be somewhat protected. So they move down the list a little bit and when they get the vaccine, especially when that vaccine is going to be so limited.
Okay, that makes sense. Mike, I have another data question for you. And I think this statistic seems to cause people a lot of confusion. So every day, we provide one of our graphs shows deaths, and sometimes the deaths were added later based on a review of the records. Can you, from what you understand, can you explain how those are reviewed and why the reviewed deaths are added to the date? Well, this person says why the reviewed deaths are added to the day they were reviewed, not to the date of the death. And I'm not sure whether that's how it works, but can you tell us a little bit more about that process as far as you understand it?
Well, I mean, it's what is reported. I'm sure the death still stays as that previous day.
Mm.
So there are people who are in the hospital who have confirmed coronavirus. They've been tested, they are there with the symptoms. Everyone in the hospital knows, or the long-term care facility. And when they die, it's a pretty easy diagnosis given perhaps what else has happened just prior to death. There are other cases where people have not tested positive, maybe they died at home, and they now have the ability to test them post-mortem, which I don't think they necessarily had as readily early on. So what they do is they look at cases and they try to determine based on symptoms that they had prior to death. I mean, I think they look at the death records from the local county, the local doctor, and then they try to find out, were they in contact with somebody who might have had a confirmed case of coronavirus. So that's why you're seeing those added deaths. Now, there's been a lot of controversy over that. There have been so many in just in this past month. When you look at the overall deaths in the state of Michigan this year, we are 13,000 ahead of the number of deaths we typically have by this point over the previous 6 years. So right now, COVID accounts for about 11,000 of those, 10 to 11,000 of those. The other ones are cases of people early on that avoided going to the hospital because everything was shut down, and they did not get treated for things they probably should have been treated for, and there were a lot of what were called extra deaths. So the overall numbers do match what the experiences are, but yes, there have been a lot of questions about those numbers, and people think that we're just kind of making them up. I would hope that they are not. Like the state of Ohio, early on did not call it a COVID death unless they were tested pre-mortem. And then they changed in April 10th or 20th. So, in that state, there were a number of cases that probably were COVID that were not recorded as such, just because of the way the state handled it. Now, I'm pretty sure Ohio now matches how Michigan does it. So that's how they do it. And in terms of matching it with the date, what we're seeing it's just the date that it's reported. They're not changing the date of actual death.
Got it. I see that there was another question that we had that's related to this.
Okay.
I think makes sense for Robin, but feel free to jump in on that, and then I'll come back to Paula. I see a question here that says, I learned that doctors are being paid for treating COVID patients. If that's true, what does that mean for real numbers of patients with the virus, and why are there no deaths from flu or cancer being reported?
Hold on. Let me jump in on that one. They are reported. I mean, that is that. Are we reporting it on a daily basis? No. Every year for a number of years in Michigan, cancer and heart disease are the number 1 and 2 killers of people in the state. This year, number 3 will be the coronavirus, but people are still dying of cancer. They are still having heart attacks, unfortunately, and passing away. So it's not that they're not reporting it, but we don't report those every day because we just never have. That was there in 2020. It was there in 2019, and in 1920. So anyhow, I'll pass the rest of the answer to Robin. Sorry about that.
Oh. You're muted, Robin.
Sorry, having trouble with my keyboard here. My fingers aren't working it very well. To the question, that's one of the, the idea of doctors being paid for COVID patients is one of those things that has just been so tough. I hear it all the time, and I've heard everything from hospitals are making tons of money to every doctor who reports a COVID death gets 30,000 extra dollars. And with everything, there's often the nugget of truth. Now, part of this is that hospitals did get CARES Act money in several different ways. So there were some payments that came to healthcare systems earlier this year based on, a couple of things: how much COVID care they provided, and then also based on their past Medicare payments. Okay, so there were those pots of money that came. There's also a 20% uplift or kind of premium on Medicare patients who are also COVID positive. But you have to keep in mind that the hospital, it costs so much more to care for a COVID patient, and it's those costs that you don't necessarily are not necessarily reimbursed for. So, Hospitals are, you know, literally millions of pieces of PPE they're burning through every week, or, you know, or whatever. I mean, there are those costs. There are the costs for, you know, healthcare personnel right now are at a premium. Everybody's fighting over there. There's these payments for this extra staff that they have to accommodate. I'm garbling this, but at the end of the day, there were some extra payments that have gone to healthcare systems for COVID care, but I don't think anyone's making money from caring for COVID patients, not at all. And if anyone knows differently, if anyone knows a doctor that's getting some super secret payment, I'd love to hear about it. I just don't know of any, and I don't know where that money would come from.
Thank you.
And there are some, we've written about the CARES Act money a little bit in the past too. So some of that is explained in some of our past stories too, if you're interested.
Excellent. Paula, this one is for you. And you have talked with a lot of businesses and you're reporting it throughout the time of this pandemic. This person is curious, just kind of based on what you're hearing from employers, you know, do you feel as though there are ways that that government or either on the state level or the national level could do something to help sort of control the spread of COVID without killing the economy and causing all sorts of different kinds of chaos? Are there any ideas out there that you've heard from employers or just from ideas you've come up with through your own reporting that might be really effective for sort of balancing these needs?
Yeah, that's the hardest question out there. And I actually found myself thinking quite a bit about that yesterday. I was having a conversation with an acquaintance from my son's swim team, you know, a parent. And, you know, what do you do? I think it's really hard to keep from looking backwards. And I can't help but wonder what our world would be like right now if we had all just said, oh yes, we're in a pandemic, we all need masks. And if we hadn't had the battles, and if reopening didn't come with, you know, everything that it came with, you know, and people didn't feel scared to go to work, and people didn't feel like they need to assert themselves with their rights not to wear a mask. You know, if we had just done it, like, what would it be like? And I think, you know, I honestly just don't know now. I don't hear any solutions. I hear a lot of concern, just an endless concern about what this is going to do to our economy, and I'm not hearing any suggestions.
Okay. It's obviously, like you say, it's the biggest question out there. How do we do this?
Right. And also, and I'll just say, like, I've been to a state that's opened, and it doesn't feel any better down there, and people down there are nervous. And yes, technically things are open, but in reality, their employees are still worried. Many of their customers are still worried, and their rates are high.
Okay, Robin, speaking of masks, Paula just mentioned masks. Can you give us sort of the latest and what's known about face masks? Which ones are the most effective? Which ones are okay but not the best? What do we know about masks?
Funny enough, I was looking for masks for my kids yesterday. I was looking for new Christmas masks online, hitting the Amazon. So there are a lot out there. You know, the first thing to keep in mind is that masks are there mostly to protect the person that you're with, but there is some protection they offer you too. I talked to somebody about this yesterday, an infectious disease person, and you know, when you're shopping the surgical masks, and please, if somebody knows differently, jump in, but the surgical masks that you buy, those are pretty much not the same, but they give you the same protection. But when it comes to the cloth masks, that's where things get a little muddy. Generally speaking, those triple layer, 100% cotton tight weave masks, those are the best. You have to keep in mind fit too. You know, if you're wearing a mask that's really loosely fitted, it's not, you know, that's not great. The other thing is to keep in mind breathability, just as is in like human nature. I wore a mask not too long ago, and I know other people have said the same thing, that was really hard to breathe through. So I constantly found myself trying to adjust it and playing with it. So obviously anything that I gained, you know, from that really tight weave, actually it was a N95, I probably lost in messing with it. So there are a lot of things to keep in mind, but you know, that tight weave and the fit, those are the you know, those are the things to keep in mind when you're looking at them.
That makes sense. Something to think about as you're doing your holiday shopping for masks.
Yeah, and I do remember earlier this year, there was a couple of months ago, there was some research done on the net gaiters, you know, kind of those stretchy material. And the thinking was that actually, in some cases, made things worse because of the way it distributed droplets. And honestly, it's really fascinating if you go online and look up some of the research videos that have been done on the distribution of droplets when we're just talking, not sneezing, not coughing, just talking. And it is really eye-opening and helpful to understand, you know, how we're exhaling and why it's so important to wear those masks.
Absolutely. All right, my next question is for Mike. Mike, this one is kind of about events. So we've got a few questions about large sort of gathering events and whether there has been any sort of surge as a result. So people mentioned the political rallies that took place around the election, as well as Thanksgiving, wanting to know if there's any evidence that suggests a surge as a result of either of those events or any other events that you've noted as you've been looking at the data.
The state has not identified any of those as a triggering or a super spreader event. Most of them were outside, which, you know, experts have said has made things a little bit better, although obviously you saw a bunch of people in airport hangars, very close proximity, and you know, there probably wasn't as good a ventilation as if you were outside. Part of the problem is when you're doing contact tracing, they'll say where were you? Some people might not have said that's where they were. At the same time they were happening, we had positive rates that were at 14%. So it could have been the rally. It could have been, you know, the when they went to the restaurant. It could have been anything. It could have been where they worked at the local factory. So that made it difficult. And at that point, we were seeing so much spread all around the state. I think it would have been hard to pinpoint one of those events. But they found the same thing, you know, that they didn't tie any of the Black Lives Matter protests to cases. There was supposition at the very beginning that the Democratic primary, you know, the Bernie Sanders rally, there wasn't any link to that as well. So they haven't. I've not seen anyone say it. It could have happened. I'm sure there was some transmission, but at the point that it was happening, there was so much transmission in the state that they've never pinpointed one of those events as the cause.
Got it. Okay. All right. This next question is for Paula. Paula, as you've talked to businesses, particularly sort of businesses that right now are dealing with the mandatory pause, so bars, restaurants, those sort of entertainment venues, has there been any talk or any lobbying on those groups' behalf to take a look at government sort of basing their decisions on whether the business itself has sort of circulated fresh air and looking at sort of the capability of its HVAC system rather than the purpose of the venue? Because we do know that, you know, the virus is spread mostly via it's a respiratory illness. So this person was curious about whether there'd been any lobbying on sort of looking at that rather than only the purpose of the business.
Yeah, I hear people mention that on an individual level. You know, for example, I talked to a bowling alley owner this week who said, you know, they've had no cases come through their door that they know of. They've done everything right. They've done the temperatures. They've done everything. But from what I see, I mean, we're in a public health crisis, and you know, the state wasn't set up to deal with a public health crisis of this magnitude. And I see like most of the resources kind of chasing like the bigger fish, so to speak. So they're tackling industries, they're tackling industry spread. For a while we were dealing with geography, but now of course the whole state has a problem. So I think people wish they were getting to that point and measuring individual buildings or individual, you know, individual businesses, but there's probably absolutely no chance of that from what I've seen.
All right, this next one is for Robin, though it looks like this one might be something that Mike might know a bit about as well. So we've had quite a few questions about sort of the way the data is reported when it comes to assisted living facilities, if it's reported separately from nursing home data, or is it possible to find out essentially what's going on in assisted living facilities as well as nursing homes? I think there's just a lot of confusion about sort of what's happening currently in these facilities and sort of what the state's doing to protect those who live in those facilities.
I can start on the data part. The state just recently, it used to just be the 450, 460 nursing homes that were included in the data. And the numbers there, obviously, as most of you are aware of, were not good. And I think nearly a third or a little over a third of all deaths were occurring in that setting. The state, there was criticized for how it was using hub facilities. I think it has made some changes, and I'm sure Robin can help us understand a little bit better. But just about 3 weeks ago, they added homes for the aged and adult foster care to that. And the numbers have got even worse. I mean, there were weeks recently where approaching half of all deaths in the state were happening in these facilities. So the problem has remained. These facilities now have better PPE, which was one of the problems early on. But it's just such a vulnerable population to this disease that, right now, since November 1st, 50% of all the deaths are people who are 80 and older. So it's when it gets into one of those facilities, these people, because of their health issues, are just not as resilient to fight off the challenges of the coronavirus.
Part of the problem is, believe it or not, it's definition. So I get calls from time to time saying, why isn't my mother's assisted living facility or my father's or grandfather's independent living facility listed? Part of that is that, a skilled nursing facility, what we usually think of as a nursing home, is a very specific category that the Centers for Medicaid and Medicare Services, Medicare and Medicaid Services, has oversight of. And therefore, so does the departments, the state department's licensing and regulatory affairs office. So it's a very specific licensed facility. So are adult foster care facilities or homes for the aged. But when you start getting into things like assisted living or independent living, some of those things are more, I don't want to say marketing tools, but they're kind of broad categories versus something that's regulated by the state. So very often you'll have somebody saying, well, this assisted living or this independent living facility isn't listed. That's because the state doesn't have oversight of it, and the state doesn't necessarily collect and may not be able to collect the data from there. That being said, there's an awful lot of, and Mike can attest to this, there's an awful lot of facilities that are supposed to be reporting every week that aren't. We're seeing, Mike, you can talk to this, sometimes the data is only coming from, let's say, 70 or 80% of the homes. So that's been a struggle.
Yeah, and the state has gotten better at it, and more facilities are giving us the information, but it could be better. Okay.
Thank you. That's helpful. I know as a reader, it's been confusing to understand all of that. So that's helpful to understand sort of the definitions of those various terms and sort of how that complicates the data. Speaking of data, Mike, this reader said, it's amazing to see how much the demographic of those who have been struck by COVID-19 have changed. In your reporting, have you noticed any sort of practices or situations that you believe are responsible for these changes? They talked about that we did report on sort of the improvement in the incidence of coronavirus in the African American population, but this reader is curious about like what in particular has made things worse for other groups that we've seen big spikes in coronavirus cases.
Well, I wrote a story today that kind of touched a little bit on this. There's no doubt that the demography of who's getting affected has changed. Back in the very first 2 months, even though African Americans only make up 14% of the state population, they were 40% of the deaths. It was a hard hit area. But also at that time, Metro Detroit had 85% of all cases and deaths, and that's where the largest proportion of African Americans live. So now, as the virus waned in Metro Detroit, and then it came back a little bit in West Michigan, hit the Upper Peninsula. Well, there aren't a lot of African Americans in the Upper Peninsula, and less so in the Metro Detroit in West Michigan. So as the geography of it changed, the demography of it also did. However, when we did a story in September, people in Detroit were hit so hard by this. You couldn't talk to anybody who didn't know people who had died. It wasn't some abstraction that, oh, I don't know anybody. No, they all knew people. There's a belief that they did start taking a little bit more seriously the mask wearing, the social distancing. And so when it has come back, and it is back now in Metro Detroit, but it still has half the rate of new cases as the state, a third the rate of the cases as you'll see in parts of northern and western Michigan. So, there's a mixture of the geography changed. Can't really infect people who don't live where the infections are, but also there's a belief that there was some measure of behavioral change that was very hard earned through a lot of pain back in April and May.
That makes sense. Thank you for explaining that, Mike. Paula, this one, you mentioned that you've been doing a lot of reporting that you didn't anticipate doing about sort of unemployment and sort of the way that this has impacted employees throughout the pandemic. What do we know about what happens when employees have to miss work due to quarantine? Are employers mandated to pay those employees? How does that all work?
You know what? I'm not sure if they're mandated or not, but they can file for unemployment at least through the end of the year, no matter what their situation is, full-time and part-time, because the pandemic unemployment assistance program is still active through the end of this month, and possibly longer if the federal government extends it. But that really opened up everything for unemployment, part-time workers, gig workers, small business owners, like the super small business owners. So self-employed, I should say. So those, you can file for unemployment based on a week's worth of income. So, if you're quarantining for 14 days, technically you could probably get 2 weeks unemployment. I think there are some industries though that do have payments for employees. My daughter, for example, works in a group home setting, and she quarantined and she ended up just having to fill out a form to be able to get paid. Robin, I don't know if you know of anything like that in healthcare.
Sorry, you're talking about like a list of when you've been exposed, you mean?
No, if you get paid if you're forced to quarantine.
I don't.
Okay.
I don't.
We still have dozens of questions, but I'm going to try and turn to some that maybe all three of you can sort of weigh in on. This one is just kind of this is one that has come out of the chat that I'm just curious, as your colleague and your friend, this has had to have been a really difficult year as a reporter. You're reporting on things that are sad and they're tragic. People losing their life, losing family members, losing their job, losing their business. But we also know that these things happen, and they happen every year. But are you able to sort of balance the data and the facts with the sort of the emotional part of the weight of everything that's happened this year? Sort of how has it been to report on this, and how do you sort of take care of yourself throughout all of this?
I'll go. As a journalist, you hope to inform people and help them understand what's going on. As a data journalist, a lot of times we'll write stories where I'm presenting something to you for the first time, right? And I've got to convince you that it's something you should care about. With the coronavirus, I never had to have that. I never had to have that conversation. I never had to convince you. We just knew from the moment it started that we were providing a service. And although we worked many days straight, many hours, and how we do our job and how many hours our work is never the story, you don't care. It has been so rewarding to know that what we did was something that people wanted to know more about. And if we informed and offered a little bit more perspective to 2 people or 200,000, again, it's been a very tiring year, and I'm talking for all of us at Bridge and anyone in the media who's worked this year. This was crazy. I mean, we had we're working 7 days a week, and whatever, a lot of people work 7 days a week. We had a dam collapse. We had an election. It was crazy. It's been the most rewarding year in my career of journalism, and I've been in it for a long time because I know what we're doing is something that is vital. I mean, look, we got 87 people. Where'd those 13 that were here before go? No, but we have 87 people here who want to care about this. So it's just been, we might be tired, but who cares? You need the information, and we can help provide it. So, and I thank you for all of your interest throughout the year, and hopefully that will continue.
Yeah, I'll say I've covered business on and off for a really long time. And the level of disclosure from strangers is off the charts for me right now. People are willing to share their stories. People want to share their stories. But you know, it can get difficult. There are times where, I don't know, you know, journalists often, if they're having a very, very emotional conversation, they're turning it into a very, very emotional story. It ends up being a tearjerker story. I'm having very, very emotional conversations, and it's ending up being 3 or 4 paragraphs in a bigger story about policy. It's like some of the emotion, because there's so much of it right now, it doesn't even rise to the top in some of our coverage. I think it enhances it, but I'm having harder conversations than I've ever had in my entire career on a regular basis.
Hey, Robin, we can't hear you, but you're not muted, so I'm not sure.
Can you hear me now?
Now we can hear you. Yep.
Oh, a very quick story. A couple of weeks ago, I covered a Michigan woman was just wonderful in letting us be part of her life in the last few days of her husband's life. And she had to make really tough decisions, just heartbreaking decisions. And as I was leaving her that day, it was one of the few times I've been out of my house this year to report. She just broke down and she's sobbing. And, you know, I mean, we're all human. I mean, you know, and I wanted to do something. I wanted to somehow comfort her, but you're, you know, like everybody, we're all trying to stand apart. I've got a face mask and even a shield on that day. And I just left that interview on my drive back thinking, what am I doing? This is just crazy. What does this all mean? Like, you know, but then I watched after the stories were published, some of the comments from people saying, I'm right there with you. Like, this is miserable. And there was one comment earlier this year from somebody sent me a note saying, why are you covering this stuff? You're getting into people's lives. But the fact is, by sharing that, I guess I take comfort in knowing that when I'm sharing those stories, we're connecting to each other. And that's the only way we're getting through this, is by understanding what we're all going through. So to your, you know, how do you self-care or how do you survive this? That's where I always come back to. And like Mike said, I appreciate those comments from readers. You know, they give us feedback, good or bad. We know that, you know, at least in making those stories and connecting, we're making a difference.
I just shared that story that Robin is referring to in the chat. I dare you to read that story and not cry. It's a hard story to read, and I know how it ends. It does not end well, but it shows us the humanity of all this. And one thing I want to mention here, one of the most frustrating things that has happened this year is I do the numbers, and I remember going, oh my God, we had 60 cases today. Well, I can't even remember back then. I mean, that was so long ago. Now, oh my God, we had 1,000. Well, now it almost got to 10,000 2 weeks ago. I know the numbers are real. I know the stories behind them are real, and it has been increasingly frustrating to see people just to dismiss them. Even in another one of Robin's story, someone who actually got the coronavirus. There would have to be a conspiracy of so many layers for every country on 5 continents or 6 continents to make this all up for what purpose? So that's been a frustrating part, but I know most people do believe that what's happening is real.
Kind of speaking of sort of the kind of public confidence right now in information, this is a question based, it's an opinion question, but it's for all 3 of you. Obviously, what everyone's talking about right now is the vaccine and the positive developments around vaccines that could treat and help us solve this pandemic. What do you think about people's willingness to take the vaccine? Do you think a majority of Michiganders will be willing to be vaccinated? What's it going to take?
I'm going to clarify something too earlier that I said or add on to it. And one of the folks here mentioned it in the chat, and he's right. I just want to clarify, somebody asked earlier if you've been exposed or if you've had COVID, should you get the vaccine? You know, and we said yes, but you know, he noted, and it's right, one of the reasons for that is because we don't know how long immunity lasts. So that's a really, really, really critical thing that we need to understand. And I wanted to make sure that point was there. To the question now, I don't know about the willingness. I think there, you know, surveys from both local surveys, and we did a survey earlier this year at Bridge, and the national surveys show that there has been reluctance. But I think some of that hesitation is being, I think there's less hesitation now, but we still have a very reluctant public, and understandably so. They're asking good questions about, you know, what the data says. So I think, you know, we're going to have this like relentless pursuit of not only the science, but making the science understandable for all of us to really help people understand whether they should get the vaccine. Public health tells us, health leaders tell us we need the vaccine. But I think there's going to have to be a lot of convincing on the part of health leaders and the state to make that happen.
Sure.
I have no idea, but I do know that it doesn't have to be 100% for it to work. It can be obviously substantially less. We've had 1 in 23 people have already gotten the virus this year in Michigan. So it does not have to be 100%. I think you also have to look at the circles within which you walk. Are most people going to be there, or are you going to go to a setting where you think there might be some more doubters? So I think we're still going to have to always be cautious. Go to the grocery store with a mask on. You're moving, you know, it's not the end of the world, but you know, I don't know. I hope a lot of people do. But I know personally, I did the New York. If anyone wants to do it, there's New York Times how to calculate how long you would, where would you be in line? A lot of us, I'm near the end of the list, so a lot of people are going to get it before I do. And Amber, you're behind me, so yeah.
And just looking through if there's any, because we're running short on time, so I'm looking to see if there's any questions that I think we could answer quickly. There's actually one that just came into the chat window here. It's about testing. So, you know, it's one thing we don't hear about as much right now is sort of long lines for testing, because I think people are talking about the vaccine a lot. But this person asks, isn't testing important even when vaccination starts and to become available, or will testing become even harder to get, do we think?
I'm not really sure what the answer is specifically to that, but I will say that, you know, we have to keep in mind, just because the vaccine is available and people are starting to get vaccinated, it doesn't mean that suddenly, pow, everything's back to normal. We all strip off our masks and have parties. I mean, that's just not the way this is going to work. So, you know, there's hope, but, you know, there's this great bright spot on the horizon. But I don't think testing is going to be any less important. You know, until we hit that herd immunity, until we get this under control, those masks, the testing, the distancing, all of those things we've been talking about, they're at the same level of importance.
Yeah, the state is doing an incredible amount of testing. It was one of the first states to get to this, you know, are kind of an arbitrary standard in terms of number of tests per week, but they've been there for a long time. I posted in the chat a link to the state's turnaround testing time, and it lists the individual places. It doesn't give them by geography, but and I know someone mentioned in Ottawa County. I don't know specifically why Ottawa County is having some issues, but there are just dozens upon dozens of places of doing it, and you should be able to get a test if you need one.
Somebody did mention though the testing is still so slow in places. I think they said it took 2 weeks for somebody to get the test and be able to return to work, and in that time there were lost wages. Mm-hmm. It's really tough. Is the demand for testing ebbs and flows? Those waiting periods are going to shorten and lengthen too.
Certainly, and
it's really tough.
I imagine the holidays probably are going to add some burden to that. You know, people wanting to know.
Absolutely.
So, well, we are coming upon 1 o'clock. Before I kind of wrap us up, Paula, Robin, Mike, is there anything that you wanted to say or add before we sign off for the day?
Just thank you for your interest.
Glad everybody joined us, and please keep talking to us. Let us know what's on your mind. Let us know when you see stories we might be missing or that you think you'd like to hear more about. Let us know when you're not happy about something. We want to hear about that too.
Yeah, we definitely depend on your feedback. I think our relationship with our readers is one of the assets of Bridge. So never hesitate to email us or let us know how we're doing.
Absolutely.
And if any of you are the people who are telling me when my charts are wrong, which happens all the time, thank you. I make mistakes all the time, and I've got an army of people out there who seem to always catch them before I do. So I thank you.
That's awesome. That's awesome. Well, thank you so much to all of you for participating today, and to Robin, Paula, and Mike for being our special guests and our experts today. Truly appreciate you all taking your lunch hour and spending it with Bridge. Just a reminder that we will be posting this recording tomorrow in Bridge. So if you know somebody who wanted to check it out but wasn't able to get a chance, you can send them that link. Our lunch break event series will resume again after the new year. Keep posted in Michigan. You'll see what the next topic will be. You'll get information about how to sign up for it. We'll probably aim for the end of January for the next one of these. Well, all that said, I hope that you all have a very happy holiday season and a happy new year, and we will talk to you in 2021. Take care. Thank you.
Healthy.